Now let us start the main topic for today. First of its kind, SPIL Protocol, simplified protocols in immediate loading. So as I was mentioning earlier, this is not just a presentation. It is my 17 years of hard work, working initially with conventional implants. So when I used to earlier work with conventional implants, I used to do everything which would include ridge splits, sinus lifts, block bone grafts, and it was really stressful, which led me to. And now with the basal implants, I realized that there is much more to implantology beyond the discussion of basal and conventional implants, because there will be patients time and again, and which we will discuss in your practice, which may benefit with the two-piece implants. And that's where I sat down roughly around 6 years back, decoding each of my cases with the advantages, disadvantages, and the advantages, disadvantages remain not only to the basal versus conventional, it remains to application based on your return of investment, which means every patient's need change not only because of the bone condition, but also to a lot of extent because of the kind of money they can invest during their dental implant procedure. How many of you agree to this simple rule that the same case may have to be treated differently simply because the cost dynamics or the expense dynamics to the patient are different, and that is why you may have to treat the same case differently with different protocols, considering this thing which has never been discussed in implantology so far? How many of you agree to this? Just type agree to the comment box. Am I audible? Am I not audible? How many of you agree to this? If you can just type agree, or if you disagree, you can just, yeah, great. Great. Thank you, Dr. Kiran, Dr. Karthik, for confirming. So when it comes to conventional implantology, which is like a conventional approach, so all these years in whatever curriculum, academics, certifications you will see, the conventional approach demands that you create ideal bone situations, which means that if you don't have bone, you need to first augment bone and then place the implants. It does not consider implantology as per the need of the patient, which means if the patient needs the teeth immediately, if the patient has medical situations which do not allow placement of augmentation procedures, the financial aspect wherein a lot of patients would not be able to afford multiple surgeries, multiple visits, it just gives zero respect or consideration to that. It's like a rigid philosophy. You have to do it that way. And it kind of forces or normalizes a prolonged healing, which means it forces you to make the patient believe that till you don't heal, you cannot have a fixed set of teeth. How many of you feel that this is something which will not work in today's modern generation where people want everything at the tip of their fingers? How many of you feel that this will not work? Just type NW in the comment box. When we compare this philosophy now to the basal philosophy, it demonstrates extreme success even in anatomical compromised cases, which means in resorb jaws also it advocates single drill immediate load protocols, graftless protocols, and lot of times they have been called unjustifiably as unconventional, and it is not allowed to get integrated into the mainstream education. The reason I cannot understand. because now there is ample literature, ample follow-ups which prove time and again that basal implantology, if done rightly, could be a blessing to so many patients who were otherwise moving around without teeth in a helpless situations. Let it be related to the cost or their hesitance to undergo grafting, or let it be to them just looking at simple immediate load solutions. How many of you agree that this dilemma is now put up on the dentist forcefully, where either he practices conventional implants or he practices basal implants? And then there are false narratives which get created over social media, or doctors who do not practice the other technique, which means a doctor who doesn't practice conventional implants will keep pointing fingers in different way on a conventional implantologist, or vice versa. There will be fingers pointed on a basal implantologist. The reason being that because of the failure of an education system which does not allow you or your practice to be put higher and your ego to be put lower, other than you calling yourself a conventional implantologist or a basal implantologist. What if I tell you that this implantology paradox itself is the solution to multiple issues, provided we open our arms to unified approach, which means that with the simplified approach, simplified thought process, you will start placing, probably even in the same case, depending upon the situation, conventional implants or basal implants, and your practice will grow simply because your approach changed from an implantologist to someone who is asking or giving the patients simplified plans in each case and every case with immediate load protocols. How many of you feel that this is something out of the box and something really exciting, and it will definitely help your practice grow when you start offering the patients both the techniques, however simplified, in a single uniform pattern? Just type agree if you agree to this thought. Now, a lot of times some people will feel, but then why Dr. Rohan Virani should advocate this practice? Who is he? Now, this what I share with you is not out of ego, but my 17 years of hard work, day and night, wherein I have placed close to 10,000 conventional implants in various situations, seen how the patients go through various procedures forcefully, and placed over 15,000 basal implants in various procedures, various ways. And now with the SPIL technique, combine them to give the extra edge to our practice. And I have seen not only the practice has rocketed, the demand from the patient for simplistic procedures have forced them to travel all the way to where I practice in Mumbai. And I want to share you this secret recipe, which if you incorporate will show similar results, I'm sure, in your practice as well.